Medicare Part D is an optional prescription drug program for Medicare recipients. You should be aware that there is a late enrollment penalty if you do not choose a Part D prescription plan. The penalty amount is 1% of the national base beneficiary premium, which was $33.06 in 2021. So, on a monthly basis, this would be 33 cents per month added to your premium for every month that you go without creditable Part D coverage. The penalty starts after 63 days without creditable coverage and will be charged to you for the remainder of your life. You pay a monthly premium for plan coverage, so instead of paying full price for your medications, you pay a copay or a percentage of the drug's cost. If you're on Social Security, your premium will be automatically deducted from your monthly benefit before you receive it. The problem is, most Medicare Part D prescription drug plans have a coverage gap, more commonly referred to as a donut hole. Let's talk about the 4 phases of Medicare Part D coverage, and this applies to both standalone Part D plans and the prescription portion of Medicare Advantage plans. Phase 1. The deductible phase. Not all plans have a deductible, but if yours does, it will be limited to no more than $480 in 2022, but it could be less. That's an insurance company decision. During Phase 1, you will typically pay 100% of your medication costs, but some plans do offer copays on generics before the deductible is met. Phase 2 is the initial coverage limit, after your deductible has been met. During this phase, you pay a copay or a stated percentage of your medication's retail cost. This phase applies until your copays equal the insurance company's retail cost, $4,330 in a calendar year. Once you hit that figure, you enter Phase 3, the so-called Medicare donut hole. In the donut hole phase, you will pay 25% coinsurance for all of your medications, and a new tally is started. Medicare defines true out-of-pocket, or TROOP, as whatever amount you pay out-of-pocket for your prescription medications that counts toward your prescription drug plan's out-of-pocket threshold. This amount resets to 0 at the start of each year, and in 2022, the threshold is $7,050, up from $6,550 in 2021. What counts toward your TROOP? Things like any costs that you paid during the deductible phase and co-payments or co-insurance amounts that you paid for prescriptions that are covered by your plan. You will also receive credit for 95% of the retail drug cost toward meeting your 2022 total out-of-pocket maximum of any medication purchased while you are in the donut hole. For example, if you purchase a $400 medication, it costs you $100, 25% since you're in the donut hole, and $380 will go towards your annual TROOP. Phase 4 is the catastrophic coverage phase, and this phase begins when your annual TROOP has been met, $7,050. In 2022, in this phase, you'd pay a minimum of $9.85 for brand name medications, $3.95 for generics, or 5% of retail costs, whichever is higher. You will stay in this phase until January 1st when the clock is reset and the process starts all over again. As you can see, Medicare Part D can be confusing, but through careful planning, you can avoid high costs. That's why it's important to review your plan each year to be sure that your coverage is meeting your needs. At Wise Medicare, we can help you assess your current Part D coverage and suggest possible cost-saving options. To find out more, call us for a no-obligation consultation today.